Thank you, Ben, for recording. So I just would like to give this general welcome, first of all, for everybody who joined in. So thank you all. As we have a very international gathering here. About half a year ago, we initiated the research task force in the ETCMA. And I must say, first of all, it's really amazing team. Some of them will present today around the topic of pain, which I think it's definitely one of the topics that put Chinese medicine on the map, and still one of the main topic that is Chinese medicine is known for, acupuncture especially. And it is actually the main reason why people would go to a doctor, will visit a physician. So pain is always a major component of human suffering, on many levels, by the way. So before also starting this presentation, I just want to say a word about research. I'm glad that so many of you joined. Usually research is not such an attractive topic. We have discussed it among ourselves. On the other hand, acupuncture specifically has a lot of different types of high quality research and therefore evidence-based parts to it. And the best way to present today acupuncture to the general public, to decision makers and policymakers is actually showing the evidence. So even if some practitioners don't feel that research is an important part of their practice, it is one of the most important, I think, parts of our profession today. And if we want to see the future integration of Chinese medicine, definitely it is one of the main topics that everybody needs to be engaged in it. In the research force, obviously, there are people who research is their passion. I must say research is also one of my passions. Once you understand research, I think it's becoming much more interesting than it seems at the first time. So I think one of the main tasks of the task force of research in the ETCMA is really to make research accessible, make everybody aware of research. So I believe everybody who is here, I'm kind of preaching to the choir. And the people who I'm talking about, I think, may not have taken this webinar, but I definitely would like you to be also the ambassadors. Sometimes it's just really to reach out to people around you and make them be more engaged in research. And as I said, at least in the ability to understand and convey the amount of evidence. I mean, this is a much better way to say than research. The amount of evidence that we have around Chinese medicine. I don't think there is any form of natural medicine that has so much evidence. And today also a mechanism of action, some of this will be probably presented. And this is the proper words that we need to start to use if we want to be integrated in any health form. And the way we see definitely in the ETCMA is Chinese medicine is a medicine. Chinese medicine is an important value for humans' health, both in prevention and in treatment. And one of the ways that Chinese medicine will gain its proper place in human health and in accessibility is due and because of research. So this is a long background just to stress how much emphasis we put on research and the big task that the task force have both to bring you the best research, but also make research accessible to everybody and especially to our members. So with all this long introduction and leaving some time for people to join in, I would like to pass the floor to Anya, who will present the research task force herself as heading it, and all the best of success to everybody in this presentation. So all the best and thank you for joining. Anya, please.
Thank you. yeah, for the good presentation, and we agree everybody should know a little bit about research because it's so important. So I would like to make a presentation of the members. I'm hoping that you can see my screen. Good, thank you. So as Yaya mentioned, the research task force was started by ETCMA, and it started about 6 months ago. There has been a little bit of change in the people who has joined the task force. At the current time, we are 4 members, and we are open to have new members if somebody would be interested in participating after today's meeting. We are hoping soon to have some more aims and objectives ready for you to read about for the research task force, but it's still a work in progress. And what we are hoping to gain today after this webinar is some ideas from you on what you might need from a research task force in terms of research. Is it that you just want to learn more about different studies? Do you need to learn how to read a published paper, or do you need help conducting research, or what is your need? So please do not hesitate to either talk to us at the end of the webinar or send us an email later on. We are really much open to ideas on how we can help you. As I said, we are 4 members, and one of the members is Sari. She is a board member in a Finnish acupuncture association called FinAcu. She works full-time as an acupuncturist at a hospital and healthcare clinic in Finland. She specializes in gynecology, obstetrics, and reproductive medicine. And she has recently completed her master's degree in Advanced Oriental Medicine at Northern College of Acupuncture, which is in New York. Then we have Dr. Aram, and he is has a master's degree in acupuncture and traditional medicine. He has been doing his residency at Chengdu in China. He's also a medical doctor, and he has started a successful wellness center in Greece, and he has helped some medical devices startups to launch their devices. And currently he is working as a director of scientific and clinical research at a university. So he is also a really busy man. Then we have Mark Bowie. He has been an acupuncturist for almost 40 years. He has been teaching for almost 30 years. He has been teaching and supervising research at 2 different acupuncture colleges in the UK. And he was a research manager for 20 years for the British Acupuncture Council. He has retired now, so he doesn't do so much work for them anymore, but he is still active in teaching and supervising. And he has been a part of different research collaboration, and he has also published papers. And then we have Gil Ton, but Gil is a Chinese medicine physician, and he's also a lecturer and researcher. He has done a PhD in a university in Taiwan. He is currently based in Amsterdam in an acupuncture clinic, and he has also published papers. And then the last one is me. My name is Anja Funder. I'm currently a board member in a Danish acupuncture association called Praktiserende Akupunktør. I've been there for 9 years, and for several years I've been in the research committee. I've been an acupuncturist for 10 years. I have my own clinic here in Denmark, where we specialize in the treatment of chronic pain and neurological disorders. I have almost completed my master's degree in Advanced Oriental Medicine. I'm currently working really, really hard on my dissertation at Northern College of Acupuncture, and I teach and disseminate acupuncture research in Denmark. And all of us in the research task force are really looking forward to help you gain much more knowledge on research. And today you're going to hear a presentation from Dr. Aram with the title Pain, the Doorway to Opportunities. Mark will do a presentation on cancer palliative pain care, and I will do a presentation on diabetic neuropathy. And as I said, Jill is unfortunately not able to join us today, so his presentation will not be done